Sustainable Development Goals. Goal 3, Good Health and Well-Being. Targets.
3.1. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. 3.2. By 2030, end preventable deaths of newborns and children under 5 years of age. With all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births. And under 5 mortality to at least as low as 25 per 1,000 live births. 3.3. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases. And combat hepatitis, waterborne diseases, and other communicable diseases. 3.4. By 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. 3.5. Strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. 3.6. By 2020, have the number of global deaths and injuries from road traffic accidents. 3.7. By 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information, and education, and the integration of reproductive health into national strategies and programs. 3.8. Achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. 3.9. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals in air, water, and soil pollution and contamination. 3.A. Strengthen the implementation of the World Health Organization Framework Convention on Tobacco Control in all countries, as appropriate. 3.B. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. Provide access to affordable essential medicines and vaccines. In accordance with the Doha Declaration on the TRIPS Agreement and Public Health, which affirms the right of developing countries to use to the full the provisions in the Agreement on Trade-related aspects of intellectual property rights regarding flexibilities to protect public health, and, in particular, provide access to medicines for all. 3.C. Substantially increase health financing and the recruitment, development, training, and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. 3.D. Strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. COVID-19 response. The World Health Organization, WHO, has been leading the global effort to tackle COVID-19. The Strategic Preparedness and Response Plan, produced by WHO and partners, outlines the public health measures that countries should take to prepare for and respond to COVID-19. The strategy update of April 2020 provides further guidance for the public health response to COVID-19 at national and subnational levels, and highlights the coordinated support that is required from the international community to meet the challenge of COVID-19. The pandemic is much more than a health crisis. It requires a whole-of-government and whole-of-society response, matching the resolve and sacrifice of frontline health workers.